Welcome to One-on-One with Nicole Sweaterton. I am here with Kate and we are discussing medical marijuana. So first, can you please tell me the difference between medical marijuana and recreational marijuana?
Medical marijuana is used to take away pain or help medical patients who needed to relax and, like I said before, feel less pain. And the other type is used just for enjoyment, and it's illegal, obviously. So you're breaking the law and you're just
Okay, so with medical marijuana, who can get this and how do they get it?
They need to be prescribed by a doctor or a health professional, obviously. I did some research, and it's very little doses. For example, I saw a video of a Parkinson's disease patient, and he was shaking uncontrollably, and it was really hard to see because you could tell that he was very uncomfortable. And then when his doctor came in and gave him the smallest dose possible, I think after a span of 45 minutes to an hour, he was completely still, and he was almost brought to tears because he has never been perfectly still before.
Okay, so now there's obviously a lot of controversy with this because people maybe they don't know the difference between medical and recreational, but still, we have a massive epidemic with opioids right now, and people might go in for a simple surgery and be prescribed a ridiculous amount of Vicodin afterwards. So who's to say that people aren't going to start saying, oh, my back is really hurting, I need some medical marijuana, and then they keep going in, and then months and months and months they keep going in. Now they have a large supply of medical marijuana, and they're using it just as if they would be recreationally. What's the difference between that, and why are people fighting for it?
I think that is a big concern as well, and I think that the doctors who are prescribing the medical marijuana, they should be a little more aware of that is what could be happening, and they should be very careful of the dosages that they are prescribing, and that if they notice a pattern of somebody continually coming in, they should really evaluate and see if they should really investigate what is going on and maybe try different drugs to see if that would help, just so if they are using it just for that, they might go to something else.
So then one last thing. There are young children all the way up to teenagers who might have some kind of disease where they might be shaking, somewhat just some kind of Parkinson's. And what if a doctor prescribes them medical marijuana? And then what if they're hooked on it? And then what if they are high through the rest of their lives? Is that really the way that we want our healthcare system to become?
I did some research and I found that marijuana isn't very addictive. The drug itself, it's just the feeling of getting high, that is what people are addicted to. But the dosages...
So it is addictive?
Yeah, I guess so, yes. But the dosages that they are prescribing, they don't get them high. It's just it's right before that, so it stops the symptoms of their whatever.
Well, I hope that we can make this work out for the best. Thank you for joining me.
Thank you.